Well, I'm at the dentist, but it's not for a teeth cleaning. It's more for a general health checkup. We'll get more into that in this episode. Hey, welcome to the Health Links podcast presented by the Health Links family of services. I'm your host, DJ Thatcher. Our mission is to engage in conversations about the medical and wellness landscape of South Carolina so we're all better informed. So we're coming to you in this episode from the offices of Water's Edge Dentistry in Mount Pleasant, joined by Dr. Nicole Dahlkemper. Dr. Dahlkemper, welcome to the Health Links podcast.
Thank you so much for having me, DJ.
Actually, welcome back to the Health Links podcast. So, hey, folks, check out episode 77. We had a virtual interview with you a couple of years ago and really focused on the dental side of the practice, which obviously you do, but it's even more than that. Tell us a bit about how you really contribute to people's overall general health.
Here at Water's Edge Dentistry, we evaluate the whole patient, not just the mouth. Patients usually come to us more frequently than their general doctor at times. So it's very important that we look at them and make sure that they're healthy, not just their mouth, but overall their whole body. When they come in, we always take their blood pressure. We're doing oral cancer screenings. We're also looking at airway to make sure that, they have a patent airway and that they're getting enough oxygen. And of course, we're checking the teeth and alignment and orthodontia and stuff too. So we really are looking at the whole body and not just the mouth.
That's really a great point because, yeah, you're right. I see my dentist more than anyone else. And most people, I guess, unless you have a chronic health problem, you're probably seeing your dentist twice a year, maybe a regular doctor once a year or even less than that. So that's a good point. In the previous podcast, we talked about all the great services you offer. Maybe real quick, just tell us about that as far as the dental side. Obviously, it's the routine dentistry and Invisalign and things like that. What else do you do from that standpoint?
Well, we do a lot of cosmetic work as well here. We do, like you mentioned before, we do a lot of Invisalign. We're one of the top providers in the area. And
that's like the invisible braces, right?
Yeah.
Okay.
And I think it's so important, not just in the past, it was a lot of cosmetics. I want straightened teeth and I want, everything to look straight and white and beautiful.
Right.
But we're doing a lot more functional orthodontics now with Invisalign to align the teeth so they're not going to fracture as much.
Oh, interesting. Okay.
Or sometimes, nobody wants the dreaded gum graft. Hey, you have to go see the periodontist because, you need surgery to, repair your gums. Nobody likes that. So if we can align the teeth properly, then we can slow down the bone loss. So hopefully they really will never need gum grafting.
This is interesting. What leads to the fractures then? Like as we grow older, things change or what?
Good question. There's two different things, misalignment of the teeth. Like there is a proper, and I won't bore you to death with the details, but there is a proper way that the teeth should hit and they should be aligned. And if you're getting too much pressure on certain teeth, you can fracture them. And then that stinks because then you have to see an oral surgeon and it's expensive to have to get the tooth pulled, get an implant. And no one really wants to, I keep saying surgery. No one wants to have to go through surgery.
Sure.
So we do a lot of non-surgical things here.
Okay, good. Well, let's get back to the wellness side now, because you mentioned a moment ago that you check people's blood pressure when they come. I've never had that at any dentist, So what are some things that you're picking up just with a routine wellness exam, maybe before you even work on the teeth?
So on everybody, we do take blood pressure just to get a baseline, just to see, how healthy they are. But then also, in the back, if I'm doing fillings on patients, I'm giving them epinephrine and I need to know a baseline of where their heart is because I took an oath to do no harm to patients.
Right.
So, that's very important. And even just the other day, which is really scary, I had a long-term patient come in. We took blood pressure and it was the highest I've ever seen.
Oh, wow.
And I've seen him for probably 10 years that we actually had to call EMS to come and take him to the hospital. And it's just really scary because he drove himself here.
Okay.
And he was going to get in the car with 200 over 115 blood pressure and, drive home. And that's scary. And if I didn't take blood pressure, I never would have caught it. And honestly, it could have caused an accident.
Yeah, right.
Something could have happened to him. So that's very scary. But blood pressure, that's why it's so important. Some people get frustrated because they get white coat syndrome and they're like, please don't take it. Please don't take it. But it is, kind of imperative that we do that because we do talk with patients' physicians. I feel like sometimes patients think I just look at teeth, but it's not just that. Sometimes surgeons have to call me to make sure that the patient's healthy enough for a knee transplant, like to get a new knee or a new shoulder. And it blows people's minds like, why would you need to do that? But if you have uncontrolled bacteria in your mouth, it can actually infect joints as well.
Wow. So you mentioned white coat syndrome. I saw a study, I think we talked about this in our last podcast. There's a study that shows like more than half of all people have anxiety about going to a dentist. And yet you've got some great reviews online that people love coming here. I'm laughing the whole time and things like that. It sounds like you're doing a good job of relieving that anxiety. So hopefully that helps.
Well, I feel like this is silly to say, I'm a dentist and I get very nervous myself. So I feel like I'm very...
Going to the dentist, you mean?
Well, cleanings I'm fine with, but if I have to get numb, a lot of us at this office here, me and my team, like we're not the best in the chair either. So I feel like we're empaths here and we try to do the best to comfort people because we know they don't like coming here.
Sure.
They always say, Dr. D, we love you. It's not you. It's just, it's just you being in my mouth. And I'm like, I get it. So like if you need a little nitrous, if you need some sedation, we can do that too. Or some people just need some music and like a weighted blanket or something to use. So.
I got you. We've got a lot of props here we're going to touch on in just a moment. But before that, some other things that you do as part of your services, it's Botox, and it's not just for cosmetic use though. Is that right?
Yeah, we do some cosmetic Botox here as well, but I do have pain patients come to me because they've gone to other doctors before and say they're having TMJ pain and they just want to do surgery.
Okay.
So again, like I said, we try to do non-surgical things to relieve pain. So sometimes we'll make appliances to help with that. Other times, if people like right here, if their jaw's hurting, they're big clenchers, and we'll put Botox like in the masseters here. Sometimes we'll do, if they're having headaches here in the back of the head, we'll also place Botox there. And we get, patients get a lot of relief from that as well.
And you mentioned you sometimes pick up on oral cancers and things like that as well.
We work very closely with some oral surgeons in town. And if we see something suspicious in the mouth, we'll take measurements. And every 4 to 6 months when we see patients, we'll track it. And if anything changes, or if it looks suspicious when patients present, then we will send off for a biopsy. And, they'll talk to the hospital. And we'd rather be safe than sorry because it's really scary how devastating oral cancer can be.
Absolutely. Well, that gives us a really good overview of the practice. And we're here more to focus on these things. And the big guy in the middle here with this great big mask is probably what we don't want, I imagine, right? Tell us about this.
This is just one example of an attachment that you would have to wear over sometimes the nose and mouth for a CPAP.
Okay.
So continue.
Tell us about that. What is CPAP and what's the condition that it's for?
So CPAP has always been the standard of care to treat sleep apnea.
Okay.
And sleep apnea is when basically you're not getting enough oxygen. The oxygen's dipping in your blood and your heart has to pump harder, and it can cause some really bad side effects if it's not treated.
So this forces air in while you're sleeping.
And this is an example. There's there's bigger ones, there's smaller ones, there's little nasal pillows. And some people who have very severe sleep apnea, they have to use this, but not every patient has to.
Right.
Some people are really scared to get a diagnosis because they think that they're going to be strapped down with an octopus on their face and they
look real sleep. Comfortable. I have some friends who do wear these. They don't like the fact they end up with marks on their face for a few hours after they wake up. So this is what we don't want. So now, is sleep apnea really that big a deal? I mean, you're snoring. Okay, so you snore, maybe you're bothering your partner, but is there more to it than that?
Yes. I mean, with snoring, sometimes snoring doesn't necessarily mean that you have sleep apnea.
Okay.
Some people have sleep apnea without even snoring. So that's really not 100% indicative if you have sleep apnea. Okay. So it's very important to have diagnostics done, have a sleep test done.
And so what would lead you to that? I'm sleeping. How do I know what I'm doing? Why do people end up coming in for an evaluation? Did someone notice that they look like they're not breathing at night or?
Well, there's a few different ways they come in. One big one is a husband and wife are now not sleeping in the same room together because of snoring. Okay. And we like to always blame the husbands that they're snoring, but in many cases, wives are too. So, I mean, I hear more from, more wives come in and are like, oh, my husband's snoring. Can you please do something about that? And then the husbands say, I'm fine. I'm just snoring. I'm asleep, so it's not bothering me.
Yeah.
This is what I hear. But I mean, if people are snoring, we don't know if it's just snoring or apnea. So I always say, we should take a test.
Yeah.
That's one route people, come in.
Okay.
Another route is people just don't feel refreshed in the morning. They're sleeping, they're in bed a full 8 to 10 hours, but they've woken up many times in the middle of the night and, they're just snoozing.
Okay.
They just can't feel refreshed. Or other patients might, 2:00 hits and they just crash. They have to take, a nap.
So those are all telltale signs that it could be something more serious. And those are very subtle signs, though. So you mentioned with the sleep apnea that the blood oxygen level drops. And what can that affect? You mentioned the heart and so forth, because it's more than just, I'm not getting a good night's sleep. It could be serious, right?
Definitely. I mean, the two major factors with cardiovascular health would be heart attacks, because if you're not getting enough oxygen, the heart has to pump harder.
Sure.
And strokes. And what research shows is that men are more prone to having early morning heart attacks. And then women are a little more apt to having strokes.
Interesting.
So that's interesting. There's also other things that people don't correlate to sleep apnea. Depression that can't be resolved, weight loss. If you have gained weight and you cannot take off those pounds, having sleep apnea disrupts hormones in your body, and you can't lose the weight. So some people who actually treat their sleep apnea are, more able to lose the pounds too. So that's, people don't put 2 and 2 together. Also, cognitive decline. Some studies are showing that untreated sleep apnea who knows if it causes Alzheimer's, but it can cause neurological issues over time.
Contribute to it sounds
Which is really scary. And ultimately, I mean, there are famous people we know that have died. It came out later from sleep apnea.
Interesting. Okay.
Carrie Fisher, Reggie White, James Gandolfini, all those.
Oh, really?
It came out later on that there may have been other issues, but sleep apnea definitely contributed.
So it sounds like the root cause of quite a few problems. So, all right.
And it can be treated. That's the great news.
Well, yeah. So, if we don't want to wear an appliance like this, we've got some other options here too. So tell us about some of these. What do we have that you might diagnose and be able to treat here?
So actually, when I am treating patients, I will take a scan to I want to look at a bunch of different things, what's going on in the body.
Okay.
I might take a 3D scan to look at the airway, to measure genetically how large is your airway.
Okay.
That's a little bit of a factor. Second of all, nasal. Do we have any issues? Can we breathe through the nose? I work closely with ENTs. If you have a deviated septum, if you have sinus issues, I mean, that's also affecting how much oxygen we're getting as well. So measuring airway, looking at how narrow or how big or small the arch is, that affects it as well. So I'm looking at all those factors first. And then what you were asking is one thing, how we can treat it is with a sleep device.
Okay.
So it's an upper and lower, almost like retainers that bring the jaw forward.
Do we have one of those here, or that's
these actually, I have all different kind of styles.
Yeah.
So here's one option. So with this, there's an upper and lower. One goes on the bottom, one goes on the top. And this one happens to have these wings on the side.
How's these things like fangs? But
fangs.
Okay, I got it. All right.
Has these fangs here. No, and it slowly brings the jaw forward. We need an appliance that's going to be adjustable.
Okay.
Because we have a starting place where we make this appliance, but we need, every patient is so darn different.
Sure.
And we need to have something that is titratable and that, we can move forward.
This is like a soft rubber or?
This is,
Yeah,
you can
really
feel it here too. And it is, it's round, it's smooth, it's comfortable. But what it does is it moves the jaw down and forward, which makes more room for the tongue, because the tongue's a culprit of obstructing the airway. And also what it does is by that movement of pulling things down and forward, it's pulling on the pharyngeal tissue of the back of the throat, and it's splinting it. It's opening the airway with the muscles and stuff as well, which is kind of interesting. So there's a few different ones. I use all of these in different situations. Every patient is so darn different. Some people are clinchers, some people are missing teeth. I just really have to customize which one I'm going to use and what's going to be the most successful for each patient.
with any of these appliances, for lack of a better word, we have to wear these for life then? Or are there some that like maybe you can realign the jaw? I don't know.
That is a very good question. I mean, usually you have to wear them for life.
Okay.
However, I do have a patient that his jaw was moving forward on its own. So I am doing some orthodontics to realign his teeth to help with that.
Okay.
However, sleep apnea is usually a progressive condition that, I mean, we do just have to monitor. I mean, there are some things that surgery that can be used to move the jaw bones forward. But again, that's surgical. It's intense. If we have major sleep apnea in 18, 19-year-old, then I might send him to a surgeon to do, a procedure to help move the jaws as well.
So if I'm coming in, I'm getting worked up for this, I'm getting some diagnostic scans and so forth, and you recommend one of these, this has to be, I guess you send some scans out or something? These have to be made somewhere else, or do you make them here? How does that work?
I am a DME provider, but I use a few different labs. I mean, these are all different companies, so depending which one I think would be the best for you, and have a conversation, with the patient. Hey, do you like this one? Here are the benefits of this, this one versus this one. So the first step would be after I had the scan, so I can measure your airway. We have a digital scanner in the back. And it's really cool. We don't have to use the goop that we used to have, back in the day.
Right.
We had orthodontics a long time ago.
Yeah.
Now we have digital scanners. Then actually we will scan your teeth. And my scanner has 6 cameras on it that basically will take pictures of all your teeth.
Oh,
and then all of a sudden on the screen, there'll be 3D models. And so that's the first step. Then I have to determine where I want your jaw to start and where it should be. And then I'll send it to the lab. And then the process begins. Of, seeing how we can treat you. And usually after maybe 3 to 4 months, I will send you back for a sleep study. We'll either do it here, or I work with a lot of providers in the area that sometimes they'll do the sleep study at the hospital.
Yeah, we skipped over that. Yeah, the sleep studies are just that. You come in and you sleep. And like I said,
you
it
don't
could be
sleep
done
here in the office, though.
Yeah.
You don't come here and sleep on this couch. But
you can do it at the hospital. Traditionally that's been done, but you have these now done at the patient's home, right, where they're in their natural environment. Tell us just a bit about that, how that works.
Definitely. What we currently use for a lot of patients, it's called a watch pad. There's a pulse oximeter that goes on the finger, and then there's like a little watch, and then you put a little sticky right here on your heart, and that's all. That's cool. All. So it's going to check a lot of different statistics, and it will give you a pretty accurate study. Yeah. Even the doctors in the hospitals are sending home with a lot of home sleep studies.
Interesting. Okay.
Sometimes we do need to go to the hospital for a more complex medical history, or if we're thinking it's narcolepsy or some other sleep disorders, because not everything's sleep apnea. I mean, there are a lot of things that can make you tired, but the home sleep studies, they're really great. They're really accurate. A lot of people have devices on their phones and also on their watches. Yeah, I mean, tracking their sleep. And they come in, they're like, hey, doc, my sleep is this, my sleep is that. That is good for screening. Like the apps have come a long way, but nothing gets us as much information as a sleep study.
Sure.
Because I've had some patients be like, oh, well, my watch is saying this. Like, do I really need a sleep study? Yeah. The answer is yes.
Interesting. So as we look at all of these different appliances and treatments and so forth, and the fact that we're bridging the gap here between dentistry and medicine, a lot of people wonder, what's the cost, or is this covered by insurance? Maybe I have medical insurance, but not dental insurance. How does that all work?
See, that's a very good question too. Okay, definitely it gets billed for medical.
Okay.
Even though I'm a dentist, it is a medical condition.
Sure.
So dental insurance does not pay for it. Now, medical insurance has come around to paying for some of these appliances now. They only used to pay for CPAP in the past. Now, that's a hard question because every insurance is so different. Yeah. Some people with really high deductibles are going to have to pay a good portion out of pocket. But the good news is I am registered with Medicare. So we are getting payment from the government, and more medical insurances are paying for some of them. But that's a hard question because every insurance is so darn different.
Sure. And I guess this is an illness maybe of age. I don't know. Are we more susceptible to sleep apnea as we age, or is it more just our general physical condition?
Both.
Okay.
Both. Now, in the past, we always thought that sleep apnea only affected very overweight people or old people. That was like the misnomer years and years ago. But just last week, I treated a 19-year-old
Oh,
that
really?
was having sleep apnea. So, it's all over the board with who I'm treating. Now, one thing that's interesting is as we get older, we don't produce collagen as much in our body, right?
Okay.
With the lack of collagen, things just get kind of loose and floppy, skin, everything, right? Well, also our airway.
Okay.
So our airway loses tone as we age.
Okay.
So that is one thing. Also, if we do put on weight, when we put on weight, fat goes everywhere in the tongue as well. So if our tongue's bigger, we're going to obstruct the airway as well.
Fat tongue.
Fat tongue. It's true. It's a true story. And also men usually are more prone to it in younger age. But as women, as we start to lose some estrogen as we get older, we're at the exact same rate of getting it as men. But us women, we're really good at making excuses. I'm busy. I have kids. For our fatigue, but it might be something a little bit more.
Gotcha. So besides taking good care of ourselves, losing weight and that sort of thing, anything else we can do to maybe prevent or treat a mild case of sleep apnea? I know some people sleep on pillows or their head is up. Anything else that we can consider?
I mean, cardiovascular health and like you said, taking care of yourself. I mean, if you're more toned, then the airway will be more toned as well. You know what? People who play musical instruments, that actually tones the throat as well. You wouldn't really think of that.
That makes sense. And breathing and,
There are other ways to treat sleep apnea, mild sleep apnea. There are positioning pillows that you can kind of put. I've seen one that's kind of like a shark fin. You kind of put on it. It won't let you lay on your back. Now, people who lay on their back are more prone because of gravity, the jaw going back even more.
That makes sense, yeah.
So there's positional things. The other day I came across there's straws, myofunctional straws that help tone the airway. Again, that's not going to fix your sleep apnea, but it helps you tone your tongue.
You blow into them or what? How does it work?
No, you drink things through these myofunctional straws.
Okay.
I mean, it will help toning. Is it going to fix things? No.
Okay.
Oh, something else I just thought about. It just got approved. It is like a tongue stimulator, hypoglossal tongue stimulator. And I think it got approved by FDA. It actually, you use it every day and it kind of vibrates the tongue and it strengthens the muscle of the tongue.
Like a device you put in your tongue or something?
Yeah, you like put it in your mouth and it helps tone the tongue.
Sounds funny or painful, I don't know, but
not painful, kind of funny.
Kind of funny,
but
right.
I mean, but research is showing, that shows. And also for mild sleep apnea, we do a treatment here that helps some. It's called night lays. And what it is it's a laser therapy, not cutting, but more rejuvenating.
Okay.
So it helps your body stimulate collagen and it helps tighten the airway and open it up a little bit too.
So Dr. D, as we finish up, a lot we covered here about general dentistry, wellness, and also, of course, sleep apnea. What final words do you want to leave the audience with?
Well, I just want everyone to be as healthy as they can. So if you feel like you may have sleep apnea, you're snoring, or you just don't feel refreshed, I mean, since COVID, everybody just wants to be healthier. Everybody wants to be more preventative. Like if you have a feeling that something might not be right, give us a call. We might be able to help. I mean, we work with a lot of physicians. We work with ENTs, sleep doctors. Call us up. My team is really trained. We'll do what we can to help you. We do distribute sleep studies here. I do realize sometimes it can take a long time to get in with a physician. It can be 3 to 6 months. Maybe coming to us, we can do the sleep study quicker and we can connect you with somebody. So just be aware of your help. And if there's anything I can do, please call us.
Terrific. And again, we're at Water's Edge Dentistry in Mount Pleasant with Dr. Nicole Dahlkemper. Dr. D, thank you so much for joining us here on the Health Links podcast.
Thanks, DJ. What a pleasure.